Welcome to the Learning Studio. You're watching our Health Sciences series where we break down the world of medicine into easy, meaningful lessons for future doctors, curious minds, and healthcare heroes. In today's video, we're talking about something every doctor, nurse, and scientist must learn. Not just to treat people, but to make the right decisions when it matters most. Today's topic is medical ethics and bioethics, the invisible compass that guides every medical action. What are medical ethics and bioethics? Imagine you're a doctor. A very sick patient comes to you, and the treatment that could help might also cause harm. What should you do? Or a young child needs a life-saving surgery, but their parents say no. What's the right thing to do? These are not science problems. They are ethics problems. Medical ethics is the set of rules that help doctors do the right thing when treating patients. Bioethics goes even wider. It includes medical research, organ donation, genetics, cloning, end-of-life care, and more. Together, they help answer questions like, what does it mean to respect a patient's choice? When is it okay to stop life support? Should we use AI in medicine if it replaces human care? Who gets the last ventilator when hospitals are full? These are hard questions, but ethics gives us a fair and human way to answer them. What do students learn in medical ethics and bioethics? Here are some of the core principles and topics students study. Autonomy, respecting a patient's right to make their own choices. Beneficence, doing what's best for the patient. Non-maleficence, first do no harm, the golden rule in medicine. Justice, making sure care is fair and equal for everyone. Informed consent, patients must understand and agree to treatments. Confidentiality, keeping patient information private and safe. End-of-life care, decisions about life support, DNR, do not resuscitate, and palliative care. Research ethics, making sure clinical trials are safe, honest, and respectful. Ethics committees, groups in hospitals that help doctors with tough decisions. Students learn to balance science with compassion, data with dignity, and logic with humanity. Real-life example, a tough choice in the ICU. Let's meet Dr. Amina. She's caring for an elderly patient on life support. The machines are keeping him alive, but his body is failing, and he's in pain. His family is heartbroken. Some say continue, some say stop. Dr. Amina doesn't rush. She calls the hospital's ethics committee. They talk to the family, review the patient's wishes, and explain the options. Together, they make a decision based on respect, care, and clarity, not just emotion. In the end, the family feels peace, not confusion, because the choice was made ethically. How ethics are used in hospitals and research. In real hospitals, doctors use ethics to guide end-of-life care, surgeries, and organ transplants. Nurses use ethics to protect patient rights and safety. Hospitals train staff to handle dilemmas with honesty and compassion. In research, scientists follow ethical rules when testing new drugs or vaccines. Genetic experts use bioethics to guide cloning, gene editing, and stem cell research. Laws and global guidelines help ensure experiments are safe, voluntary, and fair. Without ethics, science becomes dangerous, but with it, medicine becomes human. Why this is the foundation of all medicine. You can learn anatomy, you can learn pharmacology, you can even master surgery, but without ethics, you cannot become a healer. Ethics helps you listen to patients, treat every human with respect, make hard decisions with courage, and protect the soul of healthcare. It's not just about what we do in medicine, it's about why we do it. So if you dream of being a doctor who's not just smart, but wise, fair, and deeply human, then medical ethics and bioethics are where your journey begins. Thanks for joining us at the Learning Studio. Subscribe and follow our Health Sciences series, where knowledge meets kindness and science meets the heart.